And thank heavens for our assistant Monse here that is letting everybody in. But we'll go ahead and get started. Welcome everybody to the Nevada Health Authority workshop today. We'll be addressing the Rural Health Transformation Program. And so we'll go ahead and get started on our agenda. First item is public comment. No action may be taken upon the matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record and spell their last name and provide rhtp@nvha.nv.gov with written comments. Comments must be provided up to and including the day of the meeting by 5 p.m. for inclusion on the record. Is there any public comment at this time? Hearing none and none in the room, we'll move on to item number 2 of our agenda of our workshop, and we'll move to the presentation. So as I said, my name is Jason Blake. I'm happy to be here with you today, and I'll kind of kick us off through our presentation. And I'll introduce myself and also the leadership team of the RHT program, and then we'll kick on through. But I come to this as a newbie to Nevada Health Authority. I've spent my career in 2 of the smaller rural hospitals in the state of Nevada. And I'm grateful to have an opportunity to be part of this team and to work with such a wonderful and impactful grant opportunity and a program. I need to recognize Dr. Melinda Southard. She is leading our team as a deputy director of NVHA. I also want to recognize Alicia Roman. I think she's online today. She's our fiscal lead. I'll be joined on this presentation by Dina Schmidt. She's our program chief, and I'm the agency manager over the program. We did have one new employee start with us. He's a contract employee. We have with us Evan Hodges today. He's kicking along on his 4th day, so we welcome him. So the agenda of our program is on the screen, and we can make sure this is posted online so that everyone can get these slides. But we'll go in this order, and most of the information is the same as our previous workshop, but we have a few little changes to bring it up to current. But first we'll have a quick overview, followed by 4 strategic priorities. Then we'll touch on subrecipients and contractors, and then move to focus areas for the year. And at the end, we'll try to answer as many questions as we can. So with that, I'm going to move quickly through the overview because it's old news, and we want to get to the new stuff that is more pertinent to our daily schedules. The Rural Health Transformation Program was brought to be through the One Big Beautiful Bill Act that was enacted on July 4th, 2025. This is a $50 billion opportunity over the course of 5 years for rural facilities and rural healthcare to go through a sustainable transformation program and a project. The middle box there, I'll read that specifically. The program is intended to make investments in rural health and lead to truly sustainable transformation of healthcare in rural areas. 2 key terms and words in there that I like to point to is sustainable transformation. We do not want any fiscal cliffs at the end of the 5 years. We don't want to build something wonderfully fabulous and then at 5 years it's done and it goes away. And we want something that's transformational, something that truly makes a positive difference. We want to make sure that this money goes as far as it possibly can to secure the future of rural healthcare here in Nevada. Now, this opportunity was open to all 50 states, and all 50 states did apply and were awarded. And the funding was based on 50% was the baseline funding, and then 50% was on a workload funding. Now, Nevada did put in for $200,000 as recommended and suggested by CMS initially. We were awarded $179,931,608. And there are 42 cents on there, and I won't ever forget about the 42 cents. But that's what we have received for this first budget period. Once we received this notification, because the amount was different from our request of 200 million, we had to submit a revised budget. And that revised budget was submitted, and we received approval of it on February 19th, 2026. So just a couple weeks ago, we finally received the final approval on that budget. And so we are moving forward and look forward to making sure that this work gets done. On the next slide, this is, the dates are difficult because what I'm finding is we've got our state fiscal year, we've got the federal fiscal year, then we've got our budget period, and then we've got our spending periods. It's important to take a look at this slide on your own and really engrave these into your mind. The key pieces that I want to point out and pay attention to is the budget periods are, other than this first year, are October 31st through October 30th of the following year. This year is different. It began December 29th, 2025, and it will end October 30th, 2026. So this first budget period is shorter. Now, the monies that are obligated in budget period 1, which we're in now, they must be liquidated and spent by September 30th, 2027. So the monies from budget period 1 must be spent by September 30th of 2027. We have been talking to CMS about carryovers and how that might work. At this time, we have been instructed that there are no carryovers of these funds. At the end of that spending period, those funds will revert back to CMS in some form or fashion. Of course, we're going to have to find out what the direction is and guidance from CMS if a project isn't completed by that point. And so there's still more to come in that area. But please pay attention to this spreadsheet or to this slide so that you can understand those dates and deadlines. We'll move on to the strategic initiatives, and I'll just do a brief overview, and then I'll turn the time over to Dina to go into detail. So here in our state, our program has outlined 4 different initiatives. There's the Rural Health Outcomes Accelerator Program. We refer to it as the ROPE. This is evidence-based, outcomes-driven initiatives looking at chronic disease prevention and management, behavioral health, prenatal care, for examples. There are other diseases that need to be addressed in individual communities, and we hope to have projects come forward to address those needs. The next is the Flex Fund to strengthen rural health infrastructure. This is for rural critical access hospitals or rural hospitals and clinics for infrastructure needs. We hope that there will be some collaboration to leverage regional buying powers and purchasing strategies. We hope that we can find opportunities to share resources and share in projects across county lines. One important piece in here, and I'm kind of upset about this because there's some places that need some new facilities. We can't do any new construction. And so I wish we could, but that's spelled out very clearly from the federal government. The next initiative is the Workforce Recruitment and Rural Access Program. We call it the WRAP. This is truly regarding workforce recruitment and maintaining and expanding our rural access. We hope to see ideas and projects going forward to grow your own pipeline, projects regarding tuition and training support, recruitment and training, also addressing burnout, isolation, and retention. This is an opportunity here, and I hope to see a rural residency program come to be so that we can educate and bring healthcare providers, doctors into our communities, into our rural communities, and keep them there. The last initiative is the Rural Health Innovation and Technology Program, the RHIT. This is a digital thing. We're hoping to see projects or proposals regarding digital health ecosystem, rural health infrastructure in the IT areas. We hope to see patient-centered care and interoperable health data sharing systems. A key part of this is also, or to consider, is also cybersecurity. So in these 4 areas, these are the amounts of money that is allocated to each area or each initiative. So in the ROPE, this constitutes 15% of our award is $26.9 million. For the Flex Fund, which represents 20% of our award, is $35.9 million. The biggest group is the Workforce Recruitment and Rural Access Program, the WRAP, and that's 40% of our award, which totals or equates to $71.9 million. And the final initiative there is the RHIT, which is again 15%, equaling $26.9 million. We'll move to the next slide. We, in preparing this program, we set aside some money for some specific groups, and they are outlined here. So in this budget period, we are looking at 2.3 million, a little over 2.3 million for our Division of Veteran Services. We have 2.3 million, equal amount for our rural corrections, and that's going this first budget period to the Department of Corrections for their needs. We've also set aside a little over $8 million for the rural tribal health partners there. And also we have nearly 1.3 million for the presidential fitness test, and that will go to the schools for them to prepare for that. I think with that, we can move on to our next portion, and I'll turn the time over to Dina.
Thank you. Good afternoon, everybody. I'd like to just walk you through some of these, our 4 initiatives in a little bit more detail and kind of talk through what we're looking for as people are considering putting together their applications. So the Rural Health Outcome Accelerator Program is really focused on addressing chronic disease, increasing primary care. As Jason said, right, both behavioral health and mental health. We really would like to see some improvements in the rural areas around those. The $26.9 million is slated to be released through a request for proposal. So we are working in partnership with the Division of Purchasing, and we anticipate that RFP to be available and open in May of 26. So some examples of projects here, really looking at like things like created integrated care models where we're really leveraging non-traditional healthcare workforce to supplement the healthcare system, which increases access to care, participation in value-based payments, or helping providers, projects that help providers get closer to value-based payments. Formal integration of certified community health workers and peer support specialists into coordinated teams. Expanding the scope and practice or scope and capacity of partners such as your county health districts and your FQHCs in your areas who might be able to help support delivery of behavioral health and maternal health services. Initiatives in this bucket can include technology that can support care models that expand access to primary care and specialty services. Under the ROPE program, there will be priority given to proposals that promote collaborative care models that connect families to community supports and working with local agencies that provide foster care systems and children with serious emotional disorders who live in the rural areas. So that is an area that will be given priority. Keep in mind, in this and all funding through the Rural Health Transformation Program, there is a 10% administrative cap on all projects, and that includes direct and indirect expenditures. Okay, the second bucket we've talked about is the flex funds. This is really focused on capital expenditures and infrastructure. 35.9 million will be available in budget period 1. Really looking at equipment that will enhance and modernize our facilities and allow them to expand the services they can provide. In this area, we hope to see projects that increase access to remote care. We want to see an increase in the number of mobile units across the state, and increase in transport access for both emergency and non-emergency services. These funds will go out through the request for application process, so a grant process. And we are expecting to have that application released by the end of this month, so March of this year. And that application will run March of 2026, and the last day that we'll be able to accept applications under the Flex Fund program will be August 28th of 2026, or if the funds are all distributed prior to that date. Some of the areas and some ideas and example projects we're looking for here is AI-enabled clinical tools, advanced telemedicine platforms, digital healthcare applications, apps for patients. They could also include telehealth and remote care, so telehealth rooms or suites that are needed, mobile telehealth carts, remote patient monitoring tools, those types of initiatives, mobile health units, so primary care vans, mobile dental vans, things that can bring services directly to the community. We would also like to see things around the diagnostic and treatment, so digital x-ray systems, ultrasound machines. We would like to point out that maintenance plans can be included in your request. So if you have a maintenance plan for some of these big items, those can be included in your request. The other area of focus that we really would like to see an improvement in, right, is to support everybody with cybersecurity. So these funds can be used for data infrastructure, connecting systems, as well as cybersecurity. Broadband infrastructure, this is a challenge, of course, in rural areas in Nevada, but we cannot fund any broadband infrastructure. It is an unallowable cost, unfortunately, under this program. We can do minor facility alterations and renovations. Like Jason said, there is no new construction, but if you're adding, if you have current infrastructure that needs modification to bring up one of these services or bring in a new telehealth suite, those are the types of things that with CMS approval, we may be able to approve. Okay, that's everything on that one. Moving to the Workforce Recruitment and Rural Access Program. 71.9 will be available in the first budget period. And this is really focused on attracting, retaining physicians and a wide variety of other healthcare providers across rural Nevada. So strong preference will be given to rural hospitals and healthcare providers that already operate in rural counties. And we are looking to, this particular program is going to be separated into 3 different projects, 3 different areas. The first being the rural medical workforce programs. So $25.1 million will go out through an RFP in May, and that will be focused on workforce including residency programs. And then rural workforce provider recruitment and retention will be the second bucket. And that will go out through the grant process through an RFA to be released in April with a total funding amount of 32.3 million for provider recruitment and retention. And then the third bucket is provider training and apprenticeship programs. 14.9 million will be available. I'm sorry, 14.3 million will be available for provider training and apprentice programs. And that will also be a request for application. So there will be multiple requests for applications at the same time that will be open and running. So we really encourage people to plan ahead, think about your project, think about which bucket it fits the most appropriately in, and try to apply for one bucket. If you have to split it into two, you can. But if your project mostly falls into one, we will work with you through the application process, but you can apply for a comprehensive project through one bucket at a time. But if you need to split it, we can do that as well. Some of the other examples for the RAP program, as we call it, rural medical residency programs. We're really looking to expand rural medical residency programs throughout rural Nevada. And then those incentive payments, right? So the provider recruitment and retention can be incentives. Incentives can include financial assistance for housing, relocation costs, moving costs, signing bonuses, annual stipends, or paying for continual medical education. Some of the things that could be considered under training and apprenticeship is grow your own pipeline strategies, high school recruiting programs that bring high school students into the workforce, training programs that support providers that are currently providing services and in decreasing burnout, and initiatives that actually improve the speed and access to emergency medical services. So there's some training programs focused on EMS and EMS services that could be considered. Really looking at ways to create pathways for non-physician providers and allied health professionals in rural areas to support the healthcare ecosystem. Those are some of the considerations that we could be looking at through this particular funding stream. And then lastly, we have the Rural Health Innovation and Technology. This one is slated for release through a request for proposal, so a contract, 26.9 million. The contract should be released in May of 26. Really looking for focus here is electronic health record systems, interoperability of systems. Some people have been able to get electronic health record systems, but they may not be interoperable or connected. So you might need to be, you could focus on getting those connections you need to other provider networks and referral systems. Cybersecurity software and technology could fall under this bucket. Telehealth infrastructure, again, remote patient monitoring tools could also fall under this bucket. Consumer-facing tools such as AI tools that can create both administrative efficiencies for providers, but also helping patients access services, diagnostic services, and managing their chronic diseases or illnesses. Symptoms. Another idea was infrastructure such as symptom checking and triaging. And the last little bucket here is around analytic tools could be considered under this one as well. So things that help support standardization of clinical data exchange, pharmacy automation systems, or real-time population health analytics that could be used in a larger picture project trying to improve health outcomes in a particular population. Okay, so then we wanted to just give people a heads up. So in order to apply for service or to apply for the buckets, you have to be, oh, sorry, I'm jumping ahead. So go ahead. Couple things to keep in mind, right? Again, we've mentioned it. No new construction. Be aware the funding cannot supplant any in-process projects. So if you are already doing a construction project and adding telehealth, and you already have funding set aside for that, these funds cannot replace those funds. Supplanting is not allowed. It cannot, RHT funds cannot replace clinical services. So if a service is reimbursable, you cannot use funds for it. If you are bringing up a new service that currently isn't reimbursable, a new program, a new concept, and you wanted to pay for those clinical services that are not reimbursable, that's allowed. But if it's reimbursable through any insurance, we cannot pay for it. One thing to keep in mind on clinician salaries, if you can do clinician salaries and wage supports for facilities that subject their clinicians to non-compete contractual limitations, we cannot support that with these funding. The funds also cannot supplant any existing state, local, private, tribal funds. So if you already have a budget built that covers your physicians, you can't use this fund to supplant that if you've already got funds set aside. And it's also anything that's the legal responsibility of another entity. So for example, under voc rehab or the ADA, if you have an obligation to provide a service or equipment, you can't use these funds to offset that obligation. Next slide. Important thing to keep in mind, these are some of the 4 areas, if you were going to be applying for funds, we highly encourage you to start these processes now. Some of these can take weeks to get through, but you will eventually, if you are funded, will need each to be registered in each of these areas. So the first one is your Nevada business license through the Secretary of State's office. Will have to be done before an application can be approved. If you're not currently registered with a vendor, as a vendor with the state, you need to do that, and you can do that through the controller's office, their website there. And their website does have a helpline and a help desk number. So that if you run into any glitches, they're there to help you. And in the purchasing division, if you plan to apply for any of the contract RFPs, that you do need to have the Nevada ePro system. So vendors have to create an account in order to access the procurement opportunities with the division of purchasing. And then if you don't already have a unique entity ID, you are encouraged to do that before the application is approved, and you can apply for your unique entity ID at www.sam.gov. That is a federal unique identity that is required that we check it before we provide any funding to an entity. A couple of things to keep in mind as a subrecipient or contractor. If you haven't previously been a recipient, things to keep in mind is that you can be reimbursed on a monthly basis or quarterly, but it is a reimbursement-based system. You must comply with quarterly and annual reporting requirements. You are, just a reminder, you can apply for funding under more than one initiative, but if they will be managed as separate grants. So that is it on those, and I'll turn it back over to Jason to talk about what we're looking at for the rest of this year.
All right, thank you, Dina. So we're here to the end of our slide presentation, and then we'll answer questions afterwards. But just want to give an idea of some of our next steps and reminders of what you've heard. So this is our second workshop. We don't have any others formally planned right now, but that could be done quickly and easily if we continue to see a need. We will continue to update our webpage and disseminate information as best we can that way, but we'll continue to do workshops. On March 11th, 2026, so next week, we will have our first Rural Health Transformation Steering Committee meeting. It'll begin at 1 o'clock. It is a public meeting. We went through the process. We had 96 applicants, and they were all great applicants. But we had to narrow those down to a 15-member committee. And I look forward to bringing this group together. They are all well-versed and prepared to help us through this program. The steering committee is not one that will be making the decisions on who gets funded and who doesn't. We're hoping that we can avoid any conflict of interest in that way. But we are going to rely on them to help us disseminate information, also to bring back information. We'd love to hear of their opinions and ideas and directions. This is a 5-year program, and I'm sure that we will need to change directions and pivot in different times and in different directions, and we'll be relying on the steering committee to help us in that way. And so that's coming up next week on the 11th. And we hope that everybody is involved and stays engaged with our steering committee and that process. We are in the process right now of hiring staff. We can't get it done quick enough because this train is moving forward, and now the five of us, with Evan joining us on Monday, we've got a big task ahead of us. And so we are trying to hire staff members as quickly as possible there. And so if anybody's looking for jobs, please look at the state website and look at the opportunities that are there. So this month, by the end of this month, we'll have some RFAs coming out, and they will be released publicly as soon as we possibly can. They'll be for the rural veterans, the corrections, the tribes, and the flex initiatives. Those will come out this month, and that application period will run through August 28th of 2026. It is done kind of on a first come, first served basis. We're striving to review those applications and get them awarded as quickly as possible so that those sub-grantees have the opportunity to spend the money easily within the amount of time available. The other remaining RFPs and RFAs we have on here, we're striving April and May, different time periods on those. I think the RFAs will come out in April, RFPs probably in May for the other initiatives. And they will have their specific instructions involved there. Over on the left-hand side of the page, just some important things, and there is a typo in there. I tried to change it this morning, but I must not have hit save or something. All monies have to be obligated by October 30th, 2026. And all the monies that are obligated by that time must be spent by September 30th of 2027. And each budget period going forward has those affiliated dates just 1 year later. One consideration there is that this budget period is much shorter than the coming budget period. So if you have a project that may take longer than the amount of time, we suggest looking at a phased approach. What needs to be done in this first year and what can be done quickly, and then apply with a phased approach so that we know that we're going to fund so much this year and we'll be looking to fund the remaining amount the following year. We can't obligate next year's funds, but we can keep a note there, and we'll make sure that funding gets moved appropriately. And so we encourage phased approaches if you can't get the work done in this amount of time. The next thing down in the bottom left-hand corner, just some sites of information. Our website there, the RHT website, has been newly redone with a great new look and a lot of information on it. I encourage everyone to become involved with that so you understand it and you can find information quickly. On a daily basis, we are asked questions of where can I get this and where can I get that? All the information is on that website. And so it's at the end of your fingertips. If you're not part of the NBHA listserv, please sign up for that. There is a spot on the RHT website that you can sign up. But all of our RFA and RFPs will come out through that listserv so that you get that first notice. Before we go to questions and answers, I want to encourage everyone to ask questions. Some questions we can answer, some questions we can't. There's still a lot of information that we don't know from CMS, but we do have bi-weekly calls with our partners from CMS, and we can ask them anything that we have. We also have regular communication with them through email. And so if we're not able to answer questions, please submit them to us. We'll get back to you and let you know what those answers are. But the sooner to ask the questions, the better. because once these RFPs and RFAs come out, then there could be some restrictions on who and how and what we can say regarding the different projects, because they'll be within the evaluation process and scoring process. And so the sooner you can ask the questions, the better. Please utilize our email address there, rhtp@nvha.nv.gov. If you have any questions, we will respond to them as quickly as possible. And like I said, if there's an answer that we don't know, we'll get the answer and send it right back to you. All right, Dina, are you ready for questions and answers?
Yeah, before we open it up, I just noted a couple things I forgot to mention is, I think we talked about this as a 5-year cooperative agreement and what that means for the state. So a cooperative agreement means CMS is highly involved in the grant with us. And so there are certain projects that will have to require CMS approval. So timeframes could be a little bit slower than usual when it comes to getting your final notice of funding, things like that, where CMS will be involved in those discussions with us. But also that we do have to apply each year for our funds, and it is based on our performance and will be scored. So part of that is, did we get the money spent? Did we meet the goals that we outlined in our application in order to get the funding going forward? So there's no guarantee we'll get the same level or lower or higher. We really don't know yet, but we know that we will be held to anything we made promises and in our first year application. And so far we're on task for getting there, but we just want to make sure everybody understands that we do have to reapply for these funds each year. So the amount we have available each year may vary. And for those of you who may not have been a grantee or are kind of overwhelmed by the process, we do anticipate doing some technical assistance webinars for grantees. We have not set the date for those, but just know that we are here to help through the process. We want these projects to be successful. And we want to see long-term outcomes. So we will be available and scheduling those here in the near future, but just want you to know that that is part of our plan. We have not scheduled them yet, but they will be available and you'll see them on our website. So.
Excellent. Thank you. Good points. On the reporting piece, CMS is looking for not only qualitative reports, but quantitative reports. They want us to be able to show where the progress is with a good picture. And so as we go forward and as you submit these applications, be prepared and be committed to reporting. Also make sure that you address sustainability in your applications so that we don't hit any fiscal cliffs. We want this to progress all the way through the 5 years and far into the future. All right, so with that, we will do our best to answer any questions. If you'd like to come off mute, you can, or raise your hand and we'll try to answer questions. Or if you want to submit some in the chat, we'll try to get to those as well. So our first one, I don't see it anymore. Who was it? Jack? Do you have a question? If you would like to come off mute, we'll try to answer.
Hi. First off, thank you all so much for this presentation. Super well done. A lot of good information. I have 3 questions, all related to the dates for, like, the approximate date that some of these programs, the RFAs, will be dropped. So I don't know if I missed them, but for the ROAS, what was the expected RFA date for that one?
So the ROPE, which is the Health Outcome Accelerator, will be an RFP, and it will be in May of this year.
Okay, perfect. And then what was the first initiative for the workforce recruitment and rural access program, and what was the RFA for that one?
Yep, absolutely. So
It's the workforce.
So the first initiative is the medical workforce programs, and that's an RFP for $25.1 million will be available in May of 26.
Perfect. And then just lastly, the RFA for the training and apprenticeship programs.
Training and apprenticeship RFA will be released in April. 14.3 million available.
Perfect. Thank y'all so much. I really appreciate it.
And just a note for people, if you haven't gone onto our website, there is little fact sheets on our website that have all the details that I'm going over. So you're welcome to go there too if you later need to go back and refer to them. It's all available on our website. There's a one-page fact sheet for each program.
All right. Eduardo, if you'd like to ask your question, we will do our best to answer.
Absolutely. Thank you guys for putting this all together. This is all very informative, so we really appreciate your time. My question was basically, do skilled nursing facilities or any long-term care setting qualify for these funds in the rural health initiatives? I see mention of clinics and just didn't really have the specific verbiage I was looking for. And just wanted to see if those would qualify.
That's a great question. Yes, they do qualify.
Okay.
Rural providers, and we couldn't list all of them. But yes, they do qualify, and we hope to see applications.
Yeah, 100%. And then a follow-up question to that, would a platform that's an LMS qualify for this RHTP initiative, just for general education across the scope of skilled nursing facilities, or more geared towards recruitment and retention?
This is Dina, and yes, we would anticipate, I would say that would be qualified because as long as it's being used to retain your current staff or increase their skill set, right, or increase safety or outcomes, and you're tying it to one of those health outcomes that we're looking for, absolutely.
Perfect. Thank you so much. I appreciate your time.
Absolutely, thank you. And we got a question here in the room.
Hey, good afternoon, and thanks for all the great information, everybody. So I have a couple of questions. One's the funding strategy and the budget limits, that we're allowed to apply for. So are tribes going to be strictly held just to the tribal set aside, or could we apply for the other pillars also?
Great question. You can apply within the tribal set aside, but also for any of the 4 initiatives as well.
Okay, thank you. And my second question is the renovation versus construction. That one's a tricky one. So, how does the, what's allowable and unallowable? For example, we have a couple of older facilities that aren't actually on our fiber network. Fiber runs past them, but it doesn't connect them. And so would that be, an upgrade, or be new construction or renovation in order to complete the tasks of utilizing that building?
I can read you, and this is available on our site. I'll read this one sentence. This is not allowable under RHT: construction or building expansion, purchasing or significant retrofitting of buildings, cosmetic upgrades, or any other cost that materially increases the value of the capital or useful life as a direct cost. So if you have, say, a room that you want to transition into a telehealth room or a suite, that would be acceptable because you're not adding any new space, right? But if you're adding 1,000 square feet for a new clinic, that would not be allowable.
Okay.
So yeah, and we are happy if you have a project that you're considering. All of any construction projects or retrofitting projects will have to have CMS approval. So
Okay.
It's not a no, if you know what I mean, but they will be involved in that decision with us.
Okay, thank you.
Any other questions?
No.
That's it for so far?
I'll give
Okay.
everybody else a chance.
Alexa Meyer, you're up next.
Hi, can you hear me?
Yeah,
Yeah.
just barely. If you could speak up a little bit.
That is the first time anyone has told me to speak up. So I was actually also curious about the new tribal and VA funding opportunities. So I assume that the idea behind those particular funding opportunities was for specifically tribal and VA members and leadership to apply for. Is that correct?
Yes, that's correct. And in this first year for the the veterans, it will be the Nevada Department of Veteran Services that will receive that, and then they will initiate their projects from there. Now, going forward in years 2 through 5, things could change a little bit. That funding could be moved in a different direction. For the tribes, yes, it was directly for the tribes for their use and their initiatives.
Are outside entities able to partner with like VA and tribal communities? Or is this is strictly for them, to them kind of thing?
Outside entities
That's what we want.
are able to partnership and collaborate with the rural entities in those specific set-asides or in the other initiatives. The caveat in this whole thing is the benefit must be in rural Nevada, rural and frontier Nevada. And that includes if it's an out-of-state vendor that wants to bring you something in state or get some of this money, the benefit has to be collaborated and supported by the rural entities there. And so a lot of people have come asking us questions, and we have pointed them back to the rural communities to let them know they needed to gain support and collaboration there. So yes, urban entities can work to support and help the rural and frontier communities. Just need to make sure that benefit is in the proper place.
Yeah, that makes a lot of sense because I know that in the early meetings in 2025, there was quite a bit of emphasis on making sure that the benefit was staying in kind of the rural areas, making sure that that makes sense. Do you have a plan into how you plan to enforce that?
Yes, it will be through the RFA process and RFP process. Applications will need to prove support and collaboration with rural entities.
And then
Like
the grant
a letter
management.
of like a letter of support, or as partnerships in the proposal. I was just kind of wondering at what level you're kind of imagining.
Yes, on both of those, and any other specifics of how this will benefit the rural areas and the rural residents.
Yeah, we would, in an application, we would anticipate seeing letters of support, MOUs uploaded, anything of that nature that would support and show that the collaboration has been built.
Perfect. Thank you so much.
Absolutely.
All right, next we have Joseph. Is it Joseph Dunn?
Yes. My question is, do we have an idea as far as, I know that all this is going to be reimbursable. Is there an idea of how long the process to be in reverse will take? Do we have enough information on that right now?
So once
The reason I
request
ask
for-
is, reason I'm
Go ahead.
asking is that from a smaller county's perspective, we have limited funds. So it's a matter of, are we talking weeks out, months out? Do you have an idea?
So generally, once the request for reimbursement is submitted, it goes through our state process, and we have 30 days, I believe, Alicia, if you're on and want to correct me if I'm misspeaking, 30 days to get that payment back to you. But we will be trying to process.
That is the rule of thumb. Yes, we try to process those within 30 days of being submitted and approved.
Okay, great. Thank you.
All right, next we have Kavita.
Yes, thank you so much for taking my question. First of all, this was an informative session. Thank you. I can see all the hard work that was put behind this effort. Thank you. So my question is, let's say if the project has multiple components and those are interdependent, what guidance would you offer to ensure clear ownership, sustainable funding, and in terms of like operational efficiency, because those steps are, although like interdependent, but that's the yearly funding mechanism that you were describing before. So what you will guide us in order to prevent any fragmentation?
We hope not to cause fragmentation, but we also understand that some initiatives or some projects may have completely separate goals. And so I would say, and I can be changed, my mind can be changed on this. If you're submitting a project that overlaps some of the different initiatives, choose the one which it best fits. And maybe in your narrative, you can explain how it fits or where it fits, and we'll work with you going forward from there. We don't want to create more administrative burden on your side, nor on our side. We're only 5 people working on these right now, and we want to make sure that we limit the amount of administrative burden. And so I know I didn't answer your question really well, but if you feel that they're completely separate, then submit two or three or whatever different applications. But if there's some commonality and it overlaps a little bit, then we can address those with one application.
Thank you. You did answer my question. So thank you.
All right, next we have, oh, I'm gonna kill this name, Mucio?
You didn't kill it.
Mucio Ryan?
You said it right the first time. That's very
Okay.
rare. So thank you. I'm with Desert View Hospital, and first I just want to start off by saying, to you, Jason and Dina, that we very much appreciate the focus on keeping the opportunities to the rurals and validating, the need for support of rurals for people who will be proposing. That is a huge thing, and the rurals greatly appreciate it. So I also wanted to ask real quick about the when we talked about, I know this was in reference to new construction, but increasing the value of your entity. Does that apply to, let's say, if we were to submit to get a new upgraded CT? Of course, that's going to increase, probably nominally in the scheme of things, but that's going to increase our value. And so is that something that needs to be avoided, or?
No, I wouldn't say it needs to be avoided. I would say that it needs to be spelled out and defined in your application of how it's going to improve your current services.
Okay.
What new capabilities it brings to the facility and to the patient.
Understood. Thank you. And just my last question, could you clarify, there was mention that it's going to be reimbursable. Is that for all 4 pillars, or is that only particularly for the RFA or RFP, or are all expenses need to be laid out and then reimbursed?
The intention right now and the instruction that we've received is that it will all be reimbursed.
Understood. Okay. Thank you, guys.
All right. Joseph, done? Yeah.
You might not.
Do you have another question for us?
No, I don't. I'm not sure why my hand went up.
Okay.
Sorry.
Molly Huntsman, you're on next.
Hi there, I'm from the Kirk-Kerkorian School of Medicine at UNLV, and I have a couple of questions about the residency program. First of all, I want to know why is the residency program administered by Nevada Health Authority and the State Purchasing Division? I notice it's different from the other 2 funding opportunities for RAD.
So anytime we do contracts, the Division of Purchasing is responsible for the RFP process, and that program is going to be issued through contracts. And so they will be, they facilitate the request for proposal process, but then we will be responsible for the grant or the contract oversight. But they are responsible for doing, right now, they are doing procurements for any contracts.
Oh, okay. And is there any need for vendor services or licensing and such? Because I see that
If you're
on
applying, if you're applying for any of these, you'll definitely have to have, if you're going to apply for the RFPs, yes. And you can
Okay.
go to purchasing's website and they have a vendor website with all the information that you would need and all the questions you might have. We're just trying to direct people there. I'm not that familiar with the rules, but their site has all those directions on what's required. We just want people to start the process as early as possible.
Thank you. I appreciate it.
Absolutely.
And before we go to the next question, I would encourage all that are trying or planning to apply, go to those websites and get the processes going quickly if you haven't already obtained those different accesses. The sam.gov, I think it takes up to 8 weeks. And so begin now and get that done if you haven't already.
And Jason and Dina, I have posted the links to the purchasing website and the state controller's office in our chat. So
Thank you.
All right, next question comes from Angelina Craig.
Hello, Angelina Craig representing Remsa Health Care Flight. First off, I want to echo everyone's sentiment. Thank you so much for putting this together. It's very helpful. My question is around under the Flex Fund. I know that you mentioned that a big part you might be looking at is mobile health units. Do helicopters and care flight fall under a mobile health unit, especially for emergency services?
I love that question because I have a definite answer for you. Maybe.
Okay. Okay.
It says very specifically in the frequently asked questions from CMS that helicopters and airplanes would have to get their approval for sure. And so I say maybe, and hopefully there's a great explanation that we can take to CMS with a great proposal and they say yes.
Yeah, thank you so much. And we love that support because as we all know, Nevada has such huge frontier in EMS, specifically care flight aircrafts are huge for EMS in those areas. So we're just happy to be part of the conversation. So thank you.
Excellent. Thank you. Great question. What's that? Okay. Molly, do you still have a question or your hand's still up?
Sorry,
Oh,
I forgot to lower my hand. Sorry.
No problem. No problem at all. Are there any further questions from the cyber world out there?
If you haven't been following the chat, we are trying to answer as many questions as possible in the chat as well. So keep your eye out there. If you haven't been looking at it, you can look in there. There's some questions and answers in there as well.
Okay.
I have a
we have a question here in the room.
I just have a couple of questions. For the workforce recruitment, for something like the Grow Your Own pipeline, a lot of what we do at the top of the mountain is grassroots. And we do rely heavily on grant funding, mostly from private organizations to kind of keep everything going up to the standards that we want. But I'm just wondering, like, we are already doing a couple of these little initiatives, but in a way that is unique to us. How many requirements are we going to have? I'm assuming with the residency program, that's going to be highly regulated, but something like the Grow Your Own pipeline, if we're working with our local public schools and bringing them into the health system on a regular basis, you know, would something like that qualify, or is that a little bit too grassroots?
No, that's not too grassroots. That is
Okay.
exactly what it's intended for. Just keep in mind, if you have a funding source, you could use these funds to expand it
Mhm.
or add to it, but you
Mhm.
can't replace it, right? You couldn't, if you already have a grant, you know, through a couple of
Mhm.
years, or if that grant's ending, you just have to show us that it's ending and that you would like to continue. But we would need the documentation CMS is going to want us to be able to prove that you're doing something new, not
Okay.
the same thing that you already have a funding source for,
Okay.
if that makes sense. But
That does make
absolutely,
sense.
bringing kids in early and getting them interested in the field and is absolutely.
Because we've done something similar for oral health. I
Mhm.
mean, we've got our
I would
own
love to
mobile
see it.
outreach and that grant is ending, but I mean, we would love to be able to continue some of these. And then for the rope program. I know that prenatal care is one of the focuses, and that is lacking at our facility. But it does look like in the language, it's pretty well tied to Medicaid recipients. And I'm just wondering how much of a leeway, of course, obviously we want that to be part of the program, but we have a large population of women that, you know, regardless of what their socioeconomic status is, just don't go to see the doctor for prenatal care because they're too far away. So, you know, is consideration giving to the establishment of any type of prenatal care, or really you're looking for more things that are going to be Medicaid reimbursed?
If they're Medicaid reimbursed, that means that's a funding opportunity to maintain and to sustain a project going forward. If it's not currently a Medicaid supported or reimbursed service, then we would be, I think it's open. You can decide what grouping we're trying to affect, how are we going to do it, and then you'll need to have some sustainability. If it's not reimbursed through Medicaid, how are you going to keep it going after the 5 years?
Okay.
We don't want at the end of this 5 years, we don't want to hang something out there in front of the legislators and say, hey, we need your support so we can keep this going. We don't want to put that pressure on them. We need to find ways to support this and keep it going. But just because the metrics say Medicaid population, it doesn't necessarily have to be Medicaid population for your project. It can be another population, but you need to be able to show what a baseline is, how many lives we're affecting, how it's resulting. If that answers your question.
No, it does. It absolutely does.
You brought up a good thing, oral care. You're doing a project there. Me being from some very rural locations, I know that there's a lack of dentistry and oral support, provider support out there. We hope that there are some dentists or some projects that will be submitted regarding oral care. It's lacking in the rural and frontier areas. You had another question?
Well, I mean, I have a little bit of a question in terms of, I know collaboration is big. And again, like in rural communities, of course, we want to be collaborating among, you know, healthcare networks, but we found a lot of success just, you know, as a hospital collaborating with school systems and whatnot. So when it comes to things like oral health, we found the best case scenario is to go to the school, because, you know, trying to offer services where people need to come to you usually fall flat. So we would love, and even things like the presidential fitness test, I'm no longer affiliated as part of, like, you know, fundraising for the public schools, but I know that like physical education programs in Nevada are not funded, and we've done a lot of support of funding those programs in the past, and healthy nutrition programs. So I'm just wondering, like, you know, with a presidential fitness test, I'm thinking of our little public schools up there. I don't know that they're equipped to be, you know, taking advantage of this program, but I would love to be able, as a hospital liaison, to link them in and say that we have a partnership there that is tackling things like, you know, access to healthy foods and oral health. So I'm wondering, is like weight given to collaborations that are somewhat non-traditional?
Absolutely.
Okay.
I was going to say, in fact, one of these, I think, talks about school-based health centers and school-based health services and how to expand them or enhance them and have them be the connector to the healthcare system for families, right? Those types of initiatives where we're really meeting people where they are.
Yeah.
Absolutely.
Okay, great. And that's all for now, but I will email you, I'm sure.
All right,
Please.
Alexa, you have another question for us?
I do. Thank you. So it's actually on the same thread that we were just talking about. And it's more about like reporting and outcomes. So in a lot of your narrative and in, you know, your one pagers for the initiatives, you have like a little table that kind of gives examples of different activities you can do and how you would measure those outcomes. So what my question is how flexible are those outcomes? Were those just examples of some measurable outcomes that you could, but there are others that would be entertained in these proposals? Or is it that the examples that you give aren't examples, they are, this is how we expect you to report report that you are making progress?
So these are not the end all be all, I would say.
Okay.
But we do have, and we were just talking, we are working to develop our output metrics, right? So that people know what it is. In the RFA and RFP, we'll have some of those outlined, like this is what we expect you to be reporting on. Certainly, we have certain measures we have to demonstrate to CMS that we will expect our grantees to be providing us to support those measures.
Right.
Yeah, but this is
So
not an end all be all.
Okay. Okay. Thank you.
All right, next question comes from Jean, is it Freeman?
Jeannie Freeman. Good afternoon. Thank you, everyone. Quick question for you. Well, maybe not quick, but I'll ask it anyway. So the state's going to be applying for the funding each year and needs to document their status each year for CMS. And then it's also important for us to show that sustainability of what is being done. So in the RFAs and RFPs, is there going to be some sort of section where we need to explain what our long-term anticipation is associated with these applications? You know, like it may take 2 years, like we anticipate that it's going to take 2 to 3 years to build so that it can be sustainable. You know, just trying to have that planning out, because my concern is that there may be applications for 1 or 2 years, and then it's sort of, I wouldn't want vendors or entities to then step away from the process, and then we have the cliff in the middle of the 5 years, not necessarily at the end.
Yes, and you bring up a very good point. And this is me personally. The other members of the team, they might feel differently. But if an application comes in with the definition and the planning like you describe, it will rank higher in my mind because there's good thought put to it. There's a plan put to it. Whether it's a 5-year plan to complete a project or a 2-year, I want to see how you're going to carry that forward and maintain it going forward. Now, me being an ex-hospital CEO, purchasing some large equipment, a CAT scan, say for instance, I would hope to see a plan of, we're going to purchase it at this amount, we're going to have a maintenance contract for this many years at this amount, and we will maintain the maintenance program through the following years until end of life. And then at end of life, we will, through our budgeting process, through our billing processes, we will replace or upgrade that machine at end of life or something like that. So think all the way through, give us some idea of what the plan is, even on a single piece of equipment, how you're going to maintain it and keep it going through the future.
Thank you,
Good
sir.
question.
That makes a lot of sense. Thank you.
Oh, we've got a question that just popped up. Shane.
It's on mute if he's speaking.
Shane, you're on mute. If you're speaking, we'll be able to.
There we go. Sorry
Perfect.
about that. I'm curious, how many sub-awardees and sub-recipients do you think that you anticipate to have?
That's a very good question.
I don't have my crystal ball with me.
I guess it depends on how much each project costs.
Okay. And the
But,
reason I ask is and then each subrecipient is responsible for 4 quantitative measures based on that particular initiative. And so just kind of, curious, how that's managed. Is there a portal or is there some form of, because if you have, 50, 100 recipients, subrecipients, yeah.
Yeah, we just got our templates from CMS for reporting late yesterday afternoon. So we are diving into that question right now so that we can modify the RFA to ensure that we're asking everybody for, the minimum set that we need in the most standardized way. But we just got the format from them, so we're still diving into those details.
So if there are ideas around ways to help you with that, how would we, instead of just, because I don't know that would actually be in the RFA. It's kind of a, I don't know, kind of a nuanced kind of question or a solution. Is it best is to send something in to the email address and kind of address it that way?
Yes, absolutely. That's the best way. That'd be great.
Okay. And then kind of in that same vein, related to, do you guys have a good handle on, I don't see any kind of, we work across a variety of different states, and there's a lot of the initiatives and requests for like identification and mapping and assessments of your current workforce today. Do you have tools that provide you that information?
We do. I think he's on this call, our university partners, Office of Rural Health have done an amazing job and have all that information. And we use, I believe it was used as part of building our application.
Okay. And that is, do they do crosswalks from like a labor department or how would you get that information?
If you shoot me an email, I will put you in contact. I'll connect you with those. I'll get you the contact information.
That's great. Okay, thank you.
You're welcome.
It seems that's a big struggle for a lot of states.
all right. What's that?
Nicole.
Nicole has a question.
Nicole. Nicole, you're up next. Nicole, if you're speaking, you're on mute and we can't hear you yet. There you go.
I'm just technology challenged, you guys. I'm so sorry.
Hey,
Jason, team.
Hey,
So
how are
good
you?
to be here with you. I am good, and thank you so much for taking on this enormous challenge. We are so excited. I represent Great Basin College, and we just have a quick question on the workforce component. We obviously, colleges are not training doctors, or we do nurses, and we do that very well. But can we include tuition reimbursement, or are we relying on the WIOAs to help us out with that? I wasn't sure if some of this funding was going towards them, or if we can include that in our grant application.
I want to be careful the way I answer this, right? If there's a federal funding source available, again, we don't want to be supplanting. But tuition reimbursement is an allowable expense. But one thing that I just realized, and I apologize, when I talked about the RAP programs, I don't think I mentioned the funding in there does require a 5-year commitment to working in the rural areas. So if you are using these funds to reimburse somebody or to incentivize them, there will be they have to be tied to a 5-year commitment.
Okay, perfect. We're pretty familiar with that with most
I
of our
thought so.
programs. So yeah. Okay, perfect. Thanks so much.
Absolutely.
Okay. We're not seeing any more questions. Any other questions here in the room? Okay, doesn't look like it. Just want to reiterate, if there are any other burning questions that come up after this meeting, please feel free to reach out to us by email and we'll try to get answers. Please do so sooner rather than later so that we can get answers to you before applications and things like that go in. We really hope that the greatest applications come in and we can award those greatest applications. I'll speak for myself. Working 20 years in rural Nevada as a hospital CEO, I can remember many nights being kept awake, trying to figure out how am I going to do this, that, or another. I don't have money. I don't have the opportunities. I've never seen a grant opportunity like this before in my career. But this is a great opportunity for our rural and frontier communities. And I hope and I want to see the great transformation and improvements that are needed in each community. Every community is different, and so there will be needs different across the board. I truly feel privileged to be part of this process to try to give those needs and help you out with this. I've got a great team. We are all committed. We all have our ties to rural Nevada, and we really want this to be successful. So thank you for your engagement. Please stay engaged and bring any questions to us or comments that we need or we can help with. And so thank you and have a great day. Oh, wait a minute. Don't go yet. I gotta read
Oh, you
this
gotta do public comment.
I'm so sorry, guys. I need to open for public comment. This item number 3 on our agenda.
Broke the law.
No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. Comments will be limited to 3 minutes per person. Persons making comment will be asked to begin by stating their name for the record and to spell their last name and provide rhtp@nvha.nv.gov with written comments. Comments must be provided up to and including the day of the meeting by 5 p.m. for inclusion on the record. Is there any public comment? I'm a rookie with this type of stuff, so I apologize. I don't hear any public comment, and so we will adjourn our meeting at this time. Thank you all.
All right.
Yeah,
thanks,
that you
guys.
remembered. I didn't even think about it. Thanks for coming in.